So for the second part, I wanted to address some of the topics that I thought were troublesome for some people, which means that I may not tap into everything and may not hit some of the highlights that you were looking for. If not, I hope that you had already reached out to me or have reached out to me in the packet of questions, which I have. I have them right here, that you sent me. And as I said in my announcement, I've been having some technical issues getting the videos up. So I will either respond personally, which is directly one-on-one, or back on the discussion board for everybody to see, or I will hopefully be able to complete some more video time to kind of talk through some things. So this is the second part, which is where I bring to you some of the challenging topics, and the focus of those are going to be from the physiological questions that I presented to you either in the exam or on the discussion board. So it could be either one or the other. So our first discussion question that we had, and I believe it was also, or actually it may not have been a discussion question, it may have only been an exam question, just having to do with anatomical position, and you have a patient that has multiple gunshot wounds. How do you go ahead and get that documented? The idea there is just making sure that you understand how to use the terminology correctly and understand that the more detailed that your reports are as far as the specifics of the correct terminology, the better. So for example, if you had a gunshot wound that was through and through, you would have both an anterior wound and a posterior wound, correct? So you would have an entry and an exit. Rather than saying entry and exit, you would have anterior and posterior. If you had a wound that was near something, then it is proximal to that particular area. So I wanted you to be able to tell me the use of proximal versus distal and use them correctly. And it's not always correct to say that it is proximal to something if it's not in reference to something else. If that's not quite clear, let me straighten that out a little bit more. So if you are saying that it's proximal, my GSW is proximal, you have to say you are proximal to something. So there has to be another reference point, if that makes sense. Hopefully it does. If not, let me know. The same, medial lateral, not so much a reference point, but to the line, to the midline. So is your GSW more medial or lateral? And I'm showing you that backwards. So, and I'm looking at myself. So medial or lateral. So is your, as far as where on the body, is it medial or is it lateral? And so that's the idea of the terminology. Again, that's more, you may have some questions on the exam that are multiple choice questions that ask you the correct terminology. But really the idea was just to make sure that you understood that terminology and are able to present that in your reporting and in your reports to higher level of care, right? The other question that I had as I believe an exam question, and it may have also been a discussion question or a similar discussion question, is understanding positive versus negative feedback. In general, I didn't see too many issues with that. Just make sure that you are clear on those two. You can articulate your own examples for those. That's usually very helpful. If you can put it into your own words rather than just memorizing something out of the book, it'll make it more tangible. It'll make it so that it'll stick for you. The other part of that is the idea and concept of homeostasis. I want you to make sure that you understand that the body is constantly trying to find homeostasis. And it's not just the body is finding homeostasis. It's every cell in every organ system is trying to find homeostasis, and there's always something that's going to tip it one way or the other. So everything is in constant activity and trying to find that balance. So it's not just, oh, the body. No, it's the blood, it's the cell, it's, you know, it's the digestive system, it's, you know, from every, you know, atom, molecule, cell, understanding that organization, it's all trying to find homeostasis all the time. And that is the set point. That's what we're hoping for. Any disruption in that, whether that's illness, whether that's injury, is going to tip that scale one way or the other, which means that it's going to alert multiple different things. Now that we can say multiple different things as far as multiple different responses at this time, because you've now concluded your 20 chapters, right? And so you can say that any disruption in homeostasis, you are going to get some positive and some negative feedback, which is going to, and more specifically, you would be able to identify what that would be as it pertained to, I think, in chapter 4, I raised the question, what happens in tissue repair? So you would be able to now say that in tissue repair, there's two different activities that are going to happen in tissue repair, and the main goal of that is to get back to homeostasis because something has disrupted that. So that would be your discussion for positive, negative homeostasis. You should be able to relate all of that in every question now going forward. Every discussion question, every essay question now, you should be able to be thinking about how is this disrupting homeostasis, and what is the body going to do to get back. So that is the goal going forward in how you link all of these questions together, because that, at the end of the day, tomorrow, with your exam, when you come down to your essay questions, when I grade your papers, I'm looking to see, can you tell me why it's happening? Can you tell me what it should have done, what it is doing, and how it is linked to multiple other systems? And ultimately, you should always be able to come back to homeostasis and some kind of feedback systems that are working, okay? So I think one of the other next discussion questions that I posted, or maybe it wasn't a discussion question, maybe it was an exam question. I'm going to stop saying that because you guys get it. Is the idea that mannitol is a drug that we may dispense and it changes phases. The question there is, what does the change of phase mean? And why are we going to administer that medication through a filtered needle? Or why are we going to draw up that medication in a filtered needle? And I don't think that there were too many people that were off on that one too far, but ultimately we're looking at changes in state means that something can go from liquid to solid, or from liquid to gas, or sometimes all the way from gas to all the way to solid, or sometimes from solid all the way to a gas. So depending on what's going on in that situation. And obviously the weather that has kept us remote is a great example of all of that, and I'm pretty sure you guys have a pretty good handle on it. And then of course mannitol is dispensed or drawn up in a filtered needle because it does change states at 50 degrees Fahrenheit, and if we don't filter it, we could potentially be putting a solid crystalloid into the bloodstream, and this could be very problematic for our patient. So let's see, the next question. Again, I don't feel like too many people really, the first unit discussion questions are pretty basic, which is intentional. Any markdowns that you may be seeing or may have seen are mostly probably due to the fact that it just wasn't thorough enough. Again, when I'm looking at a question and a response, I'm looking to see, did you understand where it came from? So not just, here's a definition of this, here's a definition of this, here's a definition of this. That's great. How do those three definitions interact with each other, right? So that's maybe a reason that maybe there were points lacking. So there, I would say that it wasn't thorough, it wasn't concise. Other reasons that you may be missing points on discussions, or when you go back and you look at your discussion, you can say, oh, you know what, I didn't add this one detail. I'm reading your questions and I'm asking myself, did you hit all of the details? So let's say you have a question that says, so for example, we've got an IV of 5% dextrose in water, a hypotonic solution. So first off, I'm going to want to know, do you know what a hypotonic solution is? I need to know that you know that. I need to know that you can differentiate it from isotonic and from hypertonic. I know it, but I need to know that you do. And so when you're answering your questions in the final, make sure that you're asking yourself, am I telling Dana that I know the answer to this? Or am I just walking around the answer and hoping that maybe she'll give me points because I fell upon the answer, if that makes sense. So, I mean, the next question is right there. What does it mean for an IV hypotonic solution? So in the discussion questions, I may have given a little bit more, hey, I need to know this, and then I need to know this, and then I need to know this. But what I was seeing, and what I have seen, and you're not alone, is that you can tell me what these are, but you aren't connecting them back to each other. And that's really what I want to see for the final. I want to see you making connections. Try to make those connections. That's why I say go back and review the discussion questions. The discussion questions were not for me to actually grade too harshly. I do in the first couple of them just to give you a sense of, hey, look, it doesn't really seem like you're on the right path. Please come back and find the path. Reach out to me, reach out to your fellow students. But I mean, otherwise it's really more a participation point. So for me, it's an opportunity for you to practice. If I look at a question, did I answer every part of that question? If I'm looking at the textbook, did I hit every terminology, every term in that section? And then helping each other and having conversations about these things. That's what the discussion board purpose is about. So when you get into the exam, though, however, where the discussion board's a little different is that I'm not going to say, what does it mean for an IV fluid to be hypotonic? The question is simply going to say, you determine that the patient requires a 5% dextrose IV, which is a hypertonic solution. And then I'm going to continue, and then I'm going to say, describe what is happening when you administer this solution to this patient. Well, that's rather different than the discussion questions, right? Because in the discussion questions, I give you several questions to help you build it out. At this point, I'm hoping that you were able to go, okay, so I remember something similar to this. Yep, okay. And there were several different things that I remember pointing out. One, what is a hypotonic versus a hypertonic versus isotonic solution? What is going to happen? I remember Dana asking me, when I give that solution, which direction does this fluid go? Which means, oh, that's right. There was something about a solute and a solution. Okay, so solute. Oh, that means that there was a gradient, right? Okay. What was that gradient? Okay, so things go from high concentration to low concentration. Do you see how I'm building that? So when you're answering your questions, I want you thinking, did I put enough layer on this to tell Dana, I know what I'm talking about. I don't expect anybody to be an expert. I'm not even an expert. I've been studying a long time, but I'm not an expert. But I want you to at least have the basics and the fundamentals so that you can start to layer these things, because it's going to be very helpful for you as you get into paramedicine, that you have these foundations and you're already starting to think about, how does this relate to something else? Make sense? Let's see, another question, yeah, and I already sort of touched on this, but the tissue repair from chapter 4, there are 2 phases to tissue repair. Again, you are going from a homeostasis state and then you are creating some kind of chaos. So how are you going to get back? What's going to happen? And so in this question, I'm looking for not just that there are 2 processes, but also I'm looking for what is signaling to all of these cells to initiate these processes. So, So for example, we've got the inflammation process. Okay, great. What triggers the inflammation process? What cells are involved in the inflammation process? What chemicals are released by the cells in this process that communicate to other surrounding cells that initiate and make this go from this little incident here to this widespread body response, okay? That's what I'm looking for in your submissions for your final. That is what I'm hoping you were able to get to by the end of this course. So the next question that I had, it addressed the integumentary system. It addressed a burn victim, and I frequently find that students will tell me, there was not enough information to answer your question, Dana. Fair. Let me help you guide there. Let me help you get there. Let me guide you there. Okay, so the question specifically says that you are treating a burn victim and are assuring that the airway injury and other traumas are being addressed. So that is all done. Okay? That's done. You've delegated it. That's great. Your job is to tell me, describe how you will determine burn depth and the extent of the burn or burn surface area. So there are 2 things that I'm asking you. I'm asking you the depth, and I'm asking you the total body burn surface area, okay? You can tell me both of those, walking up to a complete stranger on the street. No one's around. You don't know where this person came from because it doesn't appear that there was any fire or any kind of chemical spill, and this person is just randomly there. You can tell me these things, and here's how. Everyone can usually tell me that you need the rule of 9 or the palm. Great. That's going to tell you your body surface area. Awesome. That's one of the parts. The second part is the depth. The depth of the burn. If you can tell me that there are three depths of burn, 1st degree, 2nd degree, and 3rd degree, and if you know the characteristics of all 3 of those, you then can say, hey, Dana, I walk up to this patient and I can't see anything. There's no one there to tell me anything, but here's what I do know. I know that by the rule of 9s that this patient is burned and has X percentage of burns on their body. And because I don't just see redness, I know that it's more than a 1st degree burn. Because I see blisters, I know that it's a 2nd degree burn. And because I don't see any charred skin and the patient is expressing a great amount of pain, I know that it's probably not a 3rd degree burn. I expect that you would be able to tell me those characteristics. What are you looking for? That to me is an acceptable answer. Just tell me, if it was a 1st degree burn, I would expect to see this. If it was a 2nd degree burn, I would expect to see this. And if it was a 3rd degree burn, I would expect to see this. That is what I'm looking for. So another question that I asked is, why is it an effective procedure to give fluids or medications interosteal? Okay, so I first asked, using your understanding of bony structures and spongy bone, why is this such an effective method? A lot of students come to me and they'll say, well, Dana, if I can't get an IV, then this is just a really good go-to way. Right. But why? Why is it a good go-to way, a go-to access line? Why? Great. That'll usually stimulate some questions, and if we had been face-to-face, there would have been some answers. And so usually what I hear is, well, if I can't get a line, then it's a really good way, if it's a CPR situation, I can just drill and then it goes right into the bone. Perfect. What about the bone makes it so unique? Well, that bone is connected to the central cardiovascular system. It's going to go, when we put in an IO in, it's going directly into the cardiovascular system. So it's a direct access. So that's one of the benefits to that. Another is that it can hold and take a lot of volume. It's painful, but the patient's probably not really aware of it at that time when you do an IO. But it can take a great deal of volume. So you can do fluids, you can do medications in a great amount. So that's another bonus to why we would do an IO, why it's effective. So you would have to know that the spongy bone, not just the bone, but the spongy bone, and you would have to know that spongy bone is connected and opens directly into the central cardiovascular system. And so that's the answer that I would be looking for when I am reading responses in that type of question. So in a unit 1, I think we end with the muscular muscular system. Yes, we end in the muscular system. And so the question that I presented to in the exam and in I believe the discussion board was had to do with neuromuscular blocks, drugs that we would give that that interfere with the neuromuscular junction. Here is a good example of a question that can be pretty detailed, right? I want to know, can you tell me what is happening at the neuromuscular junction typically? Typically, what is happening? Then I want to know, okay, great. Now you've just given sucks, what happens now? So I don't expect you to be a pharmacologist at this time. You'll learn the mechanism of actions with sucks when you get into pharmacology, but the text does talk about some of the what happens when we give neuromuscular blockades is how it is termed in the text, and specifically that's on page 219. So then I would want to know, can you tell me what is happening at the neuromuscular junction when you have administered sucks? And then the last part of the question that I ask is, I asked you to explain the process of muscle contraction and how the neuromuscular blocking agent sucks interferes with the contraction. So the first thing I asked you is, what's happening at the neuromuscular junction normally? Just on a everyday, I'm just sitting here, what's happening? The next thing I ask is, what would sucks what would you expect when you give sucks? What would you expect to happen? And the third thing is to actually describe what is taking place once that is administered. That would be a comprehensive, inclusive response if you could answer all of those questions. So in the discussion board, that's why it's an opportunity to discuss with each other and work that out so that you can build your layers and answer those questions concisely. And just to add here, also, that on page, I believe it's 220, yes, there's a spotlight that highlights the activity that occurs at the neuromuscular junction. So this is where it stimulated the question of the RSI, what's taking place normally. And then you go to page 219 and you talk about what's occurring when we give a neuromuscular blockade. And there are two different types, which you'll learn a little bit more in pharmacology. Not a little bit more, you'll learn a lot more in pharmacology, but you'll learn depolarizing versus non-depolarizing, and why is one called depolarizing and why is one called non-depolarizing, and what's taking place. But having that foundation of what's happening at the neuromuscular junction is going to make it a lot easier for you to understand the mechanism of action of these drugs that you're going to learn, and it's going to make it a little bit easier for you to learn pharmacology because you have an understanding of why and how, which is why I ask the questions the way that I ask them, and is also the reason why I expect the responses back from my students. I'm trying to almost, I guess, practice an anticipation of what is to come. Hey, I've been there, so I do know. Moving on. So, Unit 2, I start with the nervous system, and I think it's pretty straightforward, the question that I ask for the nervous system. Now, this is a huge chapter, and I'm a neuro nerd. Literally, I'm a neuroscientist. So I'm a neuro nerd, and I'm proud of it, and that's okay. But the question that I focused on, I don't think anybody had an issue with, except if you didn't answer the question thoroughly. Again, I asked you, what is an ischemic stroke? What is a hemorrhagic stroke? And then I asked you if I gave a fibrolytic agent, which stroke would I give it to and why? So not just I would give it or I wouldn't give it, but why? And I think that, any points off of a question like that on an exam is going to be because there was a part that was missing. Or maybe there was a part that was mixed up. Maybe you mistyped something, and you told me that a ischemic stroke was a ruptured vessel or something. So something was missing. So when you are looking at your questions, your discussion questions, your exam questions, what was missing? Could you tell me, walk me through by reading it, Dana, I understand what each one of these are, and I understand when and why I would give this drug and when and why I would not. That is a comprehensive, conclusive answer or response, okay? So that is the nervous system. I don't think too many people strayed on that one. Let's see. We moved over to special senses. I know that there were some people that had some questions on special senses, particularly having to do with the eye. Don't forget that we have other senses, so don't forget that the questions that you may get for special senses will probably be anywhere from 1 to 3 on the exam, for sure, multiple choice or true and false, some kind of combination. But don't forget that we have other senses. But eyes are very helpful to what we do, and we use them a lot. We rely on them a lot. So, but in this particular area, I focused on the body neuroceptors found, and so my question was, where are they located? What do they do? Let's see. How would a patient describe the sensations that they are feeling from these receptors? And then I ask, what are some challenges in being in medicine in general? What are some challenges that we face when treating patients with complaints and sensations at these receptors? So that's a whole lot. That for such a small, a small question, explain what they are. Okay, well, I can explain them. Okay, now, how do they communicate with the other body systems? That's 2. Describe how a patient would express what they're feeling when these receptors are stimulated. That's 3. What are challenges as healthcare providers in getting the report from the patient? Well, I feel this. What are some challenges in that? And then I also asked what are some common therapies that we use. So that was a pretty big question. And so if you missed any points, or if you look back at your answer and you feel like, I think I probably only answered a couple of those, well, then you didn't do yourself justice. Again, I'm not discussion questions are not. I'm not here to, be any, be a bad guy. But I do believe that was a question that came up on the exam. So first things first, these are free nerve endings. So these are free nerve endings. And another thing to watch out for is that, and interestingly on the exam, things were so close to the textbook that I think I've even had to remind people, be very, 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 very careful about plagiarism. Okay, that is very, very serious. But so these are free nerve endings. They are mostly found in superficial portions of the skin, the integumentary system, the joints, and the covering of bones and blood and around blood vessel walls. So that's where they are. That's what they are. So it's kind of like the who, what, when, where, and why. That's what we're kind of doing right now. So we also know that these receptors, they are not usually located in deep organs, deep tissues. There's a few, but it's limited there. But they have large receptive fields. So that's something to kind of keep in mind. This is part of why it's such a challenge, or one of the reasons why it's such a challenge to take care of a patient that is complaining of pain, because there is such a wide receptive field that while they may be feeling something here, it's in fact somewhere, you've got this area here. That's a lot of area. That's like, well, my chest hurts. Goodness. Well, your whole chest is, this box right here. So what does that mean? So now you have to ask the right questions to come up with your differentials, right? So that's one of the reasons that it can be a challenge. So let's see, how do they communicate? Well, they communicate, and a lot of people miss this. I'll tell you, a lot of people miss this, and it's easy to just kind of glaze over this and think, oh, that maybe that's a big medical term, and you just don't. But the way that these receptors communicate is through myelinated and non-myelinated or unmyelinated axons. Okay, so that's a nervous system, isn't it? But we're in general senses. The two organ systems do relate to each other. Another example on, you can have one system that interacts with multiple systems, and how does that work, right? So I would want you to tell me, what is the difference between the two? And that was an expectation that I have for that question. And then not only that, but myelinated and unmyelinated axons communicate pain differently. So myelinated is usually experienced by the patient as a prickly feeling, while unmyelinated is a burning, achy feeling. Okay, so that in usually unmyelinated axons, that burning, aching, like my chest is hurting, that's a very generalized statement. It's a very generalized area. So you can, knowing the difference between the two, you can then differentiate, and that will help steer your differential. So, and the other thing to discuss with pain, another complication that we have is something that we call referred pain, kind of leading back to the fact that we've got these areas that are have large receptive areas. So you may have a gallbladder that's inflamed, but the patient is complaining of shoulder pain. That doesn't seem to make any sense. Well, why do you have shoulder pain? Well, did you do anything? Did you hurt yourself? Did you throw it out? Like, no. So you have to know that there are certain instances where there are organ pains that are felt in different areas, and that's called referred pain. Okay, and visceral organs that are typically present themselves with referred pain, so you have to know how to differentiate that. So let's see, endocrine system. Yes, endocrine system. So there were a couple of questions I think that came up for endocrine system for exam questions. So the first one is a pretty, you would think pretty general, is so specifically, how does the endocrine system affect other organ systems? And then I go on to say, how does the nervous system differ from the way that it communicates to the body compared to the endocrine system? So there's at least 2 questions in there. There's probably more. And there are. So I'm asking you, why am I asking you now to link in the nervous system to the endocrine system? Why are we going back and talking about the nervous system? Well, both of them communicate through chemicals, right? So both of them use chemicals, but they use them in different ways, and they're called different things. So then they're different. They both communicate with the body, so they're similar in a way. They communicate with different parts of the body, right? And they control different parts of the body. So they both control things. So for me, I want you to be able to tell me the endocrine system and what it does. So first and foremost, what does the endocrine system do? And I believe at the beginning of the chapter, I think it pinpoints like 5 or 6, it highlights 5 or 6 points of what the endocrine system does. Let's see. Yeah, explains the rules. Yeah. So definitely want to know, do you know what the endocrine system does? So here are my notes of what the endocrine system does. So we've got, let's see, it adjusts homeostatic processes that effectively change body functions. So homeostasis, there it is again, in the endocrine system. So let's see, the endocrine system, it is the long-term regulation of homeostatic body systems. All right. So it's actually a system that's easily overlooked, but pretty intricate. I know I've got some questions about how do I know what hormones are from where and from what, and I'll address that either, like I said, typed up on the discussion board, or I'll do a video. But yeah. So also the endocrine system adjusts metabolic rates of all tissues, so it's involved in metabolics. It has some it's known to regulate growth and development, and that kind of makes sense if we think about it, because you think about how does the endocrine system communicate with other body systems. Well, it uses hormones, which are chemicals, but specifically these chemicals are called hormones. And we know that way back when we were in school, we remember that, there is puberty, and there's this point in life where there's a developmental stage change, and there's a flood of hormones that changes a lot of different things. So that makes sense, the endocrine system, right? Let's see, it releases, so it secretes so that neighboring cells are affected. So it's a secretion system. So the endocrine system it's ductless. It just secretes out, usually into the blood system. And that's how it circulates in the cardiovascular system until it reaches a target cell. So there's that. That's how it gets to its destination, and that's how it communicates through hormones and travels through the bloodstream, and that's how it gets there, which is vastly different than the nervous system, which travels down axons and is very concise and it works with chemicals, but it's working with neurotransmitters, and it's traveling down the axon, creating action potentials. So those are key things that I expect to see answers back from the respondent, okay? That you can talk about all these little different terminology and indicate to me that you know what I'm asking, and you could effectively communicate that, okay? So let's see, the other part that I have about hormones is that they change the operations of the cell by changing the type, activity, location, and quantity, and that's all from the book. So type, activity, location, and quantity. By changing these four things of enzymes and proteins of their target cell. So a good example of this is insulin. Insulin is secreted by the pancreas, and it travels in the bloodstream, and then it finally gets to a cell, and it is the key for this cell is usually how we will term it. So the insulin is a key to the target cell. It connects with the target cell, which changes, and it changes its cellular operation. It may even change some of its structure, and so then it is now open for glucose to come through and to feed the cell, right? So that would be an example of a hormone changing the target cell's enzyme and proteins and making it so that it can be responsive to something else. So again, hormones are chemical messages that are released into the blood. They are they travel pretty, I mean slow in comparing to the nervous system. They could linger for a while. Usually they will linger in that system until they are utilized or they are filtered out. So a good example would be anybody that needs hormone replacement therapy, somebody that maybe had a hysterectomy or has low testosterone and they need a hormonal therapy. So what they do is they measure everything and you're here, and so then you get this bump and you're then here, and then slowly over time those levels will decrease, and then you'll get to a point where, okay, they check your blood again, and then, oh, you're here, so we need to give you this much to get you back up here. So, and it's long term. So that slow process is a long term process. When you compare it to the nervous system, which communicates through chemicals that create action potentials across synapses, these are short-lived. This is fast. This is boom, 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 boom. There's no lingering. Fast transmission, okay? So that is the one of the endocrine system questions that was asked in the exam, I believe, for some people. Another endocrine question that I asked had to do with using your understanding of insulin on body cells. Explain why insulin shock or hypoglycemia is a medical emergency. That's one part. Why is an altered mental status, like acting inappropriate or bizarre, an important sign of hypoglycemia? So the first thing that I'm asking is, can you tell me what is your understanding of insulin? What is your understanding of insulin on other blood body cells? Explain insulin shock or hypoglycemia, right? And then explain to me why it's a medical emergency. That's like 4 things right there. That's 4 things. And that's not even like the next question is the 5th one. So you notice that there's always probably 5 things that I'm looking for. So be concise. Make sure when you're reading a question, pick it apart. Can you tell me everything that should be normally happening? Can you tell me, because there's probably something that I'm telling you that is wrong. Something has gone out of the homeostasis norm. So can you tell me, what is it? Why is that happening? And there's usually another question that is, why is this important to know, right? How does this pertain to paramedicine? So, this type of question, this is a pretty big one. So my recommendation is go through, make sure that you understand, what do the alpha cells do? What do the beta cells do in the pancreas? Make sure that you understand the key to the last question. Why is altered mental status a good indicator that there could be a hypoglycemic emergency going on? Is to understand that glucose is the only energy source that neurotissue uses normally. And that is very specific, because if you just tell me something like glucose is the only energy source that the brain uses, well, that's true, but it's also the only, but the brain is not the only tissue that uses glucose primarily or solely. It's neurotissue in general. So that would just be like an extra, like I would star, and I do when I grade, I star questions that I'm like, oh, major bonus right there. Like that's awesome. I'm gonna use that as an example. So, so that's what I'm looking for in this question. So I'm looking for, can you tell me what happens when blood sugar is elevated? What cells in the pancreas are going to release what? What happens when blood sugar is low? What does that mean? What does that mean in the blood? What does that mean that the pancreas is going to do? What does that mean? What are we hoping that the response is at the target cell? So, talk about what insulin does.